Dr. Jafari Hassad, don't pick up that folder. Leave it closed.
This operation had been in the works for 9 months. Dr. Roya Jafari Hassad walked right into it, and every one of those 10 visits was recorded.
This is a matter of records in a hallway.
We recorded 10 undercover visits, same pattern, cash visit, pain complaints, Oxycodone. He wasn't a patient, he was an undercover detective.
Then he performed symptoms to get a prescription. That does not turn every appointment fee to a crime.
She would not get the chance to explain. Within 72 hours, DEA diversion investigators had seized her prescription pads, 3 office computers, and a ledger written in her own hand tracking cash payments across 942 visits. 3 offices, 10 undercover buys on tape, hundreds of thousands of dollars a year in cash for oxycodone prescriptions that served no legitimate medical purpose. And in some of the files investigators pulled, there was no appointment, no exam, no patient in the room, only a payment and a prescription written to match. Real talk. Have you ever paid a doctor in cash and wondered why they wanted it that way? Drop that story in the comments. Hit subscribe if you are new here. We cover cases like this every single week, and this one gets darker before it gets clearer. Roya Jafari Hassad was born in Tehran in 1969, 3 years before the revolution reshaped every family she knew. Her father was a hospital pharmacist. Her mother taught grade school. They were middle class, secular, and quietly ambitious for the only daughter in a house of 3 children. The family left Iran in 1980 when Roya was 11. They landed first in Vienna, then in Queens, in a walk-up apartment on 108th Street that smelled like her mother's saffron rice and her father's Marlboro Lights. Her father worked nights sorting prescriptions at a Rite Aid on Queens Boulevard for $4.25 an hour. Her mother cleaned offices in Long Island City. Roya learned English in 6 months and finished at Forest Hills High School with a 97 average and a stack of AP credits her guidance counselor did not know what to do with. She wanted to be a doctor from the beginning. Her father talked about medicine the way other fathers talked about baseball, and by the time Roya was 14, she could name every drug on his pharmacy shelf and what it treated. She was accepted to Stony Brook University on a partial scholarship in 1987, majored in biology, and graduated summa cum laude in 1991. Medical school followed at SUNY Downstate in Brooklyn. She graduated in 1995, matched into family medicine, and did her residency at Long Island Jewish Medical Center in New Hyde Park. Her attending physicians wrote that she was clinically sharp, culturally attentive, and worked exceptionally well with anxious patients. One noted that she communicated fluently with Farsi-speaking and Spanish-speaking populations and would be an asset to any community practice. Another wrote that she had, quote, unusually steady hands and an unusually steady temperament for a young resident. She married Reza Jafari Hassad in 1997, a civil engineer she had met through a cousin. They bought a colonial on 214th Street in Bayside in 2001 for $480,000. Their daughter, Niku, was born the following year. Their son, Aria, was born in 2005. She opened her first solo family practice in Great Neck in 2003. The office was on Middle Neck Road, above a dry cleaner and next to a kosher bakery, and she started with 11 patients transferred from her residency clinic. Within 4 years, she had over 1,000 active charts. Persian, Chinese, Israeli, Colombian, and Bangladeshi families lined the waiting room on Saturday mornings. She kept her hours late. She took walk-ins. She discounted co-pays for anyone she thought could not afford them. Her Yelp reviews called her patient, warm, and unusually generous with her time. By 2010, she had opened a satellite office in Forest Hills, in the medical suite of a co-op on Queens Boulevard. By 2015, she had a third practice on East 60th Street in Manhattan. Her staff described her as demanding but fair. Her billing department called her obsessive about coding accuracy. Her patients called her Dr. Roya. She drove a leased Mercedes GLE. She sent both kids to the Bay School and then to Great Neck South High. She was on the alumni board at Stony Brook. She hosted Nowruz dinners for 30 people every March. She was, by every observable measure, a self-made American physician, doing exactly what her father had dreamed for her at that Rite Aid on Queens Boulevard. That was the picture from the outside. The paper trail from the inside would eventually tell a different story. To understand what Roya Jafari Hassad did, you need to understand what a prescription pad actually is. In New York State, a physician's prescription pad for a Schedule II controlled substance is one of the most heavily regulated pieces of paper in the country. Oxycodone sits at the top of that schedule. It is legal, it is medically indispensable for certain acute and chronic conditions, and it is one of the single most abused drugs in American history. Between 1999 and 2020, more than 500,000 Americans died from opioid overdoses. A significant portion of those deaths began with a prescription written by a licensed doctor. Every oxycodone script a physician writes is logged. In New York, the log lives inside the prescription monitoring program called iStop, and every doctor is required to check it before prescribing, and every pharmacist is required to check it before dispensing. The system is supposed to make pill mills structurally impossible, but the law does not remove the doctor's discretion. It documents it. If a physician writes a script for oxycodone, and the exam note in the chart says the patient reported severe lower back pain and rated it 8 out of 10, and the doctor documented a physical exam and considered alternatives, the prescription is legal. The chart is the shield. The chart is the story the doctor tells the state about why the prescription made sense. There was a second system running in parallel, the insurance system. Medicare, Medicaid, Aetna, United, Cigna, Blue Cross. When a doctor sees a patient, she assigns a billing code, and that code tells the insurer what to pay. A brief office visit for an established patient bills at one rate. A comprehensive visit with counseling bills at a higher rate. A minor procedure bills higher still. Every code corresponds to a specific set of things the doctor is claiming to have done. The insurer trusts the doctor. There is no way for a Medicare adjuster in Baltimore to know whether a physician in Great Neck actually removed a small skin lesion on a Tuesday afternoon in October. They rely on the code, and they pay the code. Every family practice in the country runs on those two systems. Prescription monitoring on one side, insurance billing on the other. Both depend on the same thing. They depend on the doctor telling the truth. Jafari Hassad understood both systems intimately. She had been operating inside them for over 15 years. She knew exactly where the checks were, and she knew where the checks were not. The first documented cash for script transaction in the federal indictment was dated January 14, 2019. A patient identified in court records only as AM paid $350 in cash at the front desk of the Great Neck office and left with a prescription for a 15-day supply of oxycodone 30 milligram tablets. The chart note for the visit read, "Patient reports chronic lower back pain, worsening, requesting continuation of prior regimen." There was no prior regimen documented anywhere in AMIDA's chart. He had been seen twice before, both times for a sinus infection and an annual physical. The scheme escalated over the next 12 months. By January 2020, Jafari Hassad had 31 patients on a monthly cash for oxy cycle across her 3 offices. Some paid $350 for 15 days. Some paid $700 for 30. A handful paid $1,200 for a 30-day supply of higher dose 30 milligram tablets. No exam, cash only, envelope handed to the front desk folded into a medical intake form. The mechanics were nearly identical every time. The patient would call the office. The receptionist, a woman later named as an unindicted co-conspirator, would schedule a 15-minute follow-up. The patient would arrive, hand cash in an envelope to the front desk, wait less than 5 minutes, and be handed a signed script. In some months, the patient was never actually placed in an exam room. In some months, the patient never physically came in at all. They would call, send a payment through a friend, and pick up a prescription at the front desk that afternoon. The exam room fiction, when it happened, was thin. A chart note in July 2020 for a patient named in the indictment as DT read verbatim, "Patient reports pain unchanged," RX continued. That was the entire note. No vitals, no physical exam, no discussion of alternatives, no attempt at physical therapy, no referral, no follow-up plan. The prescription written on that note was for 120 tablets of Oxycodone 30 milligram, one of the most abused doses in the entire American pharmaceutical inventory. She wrote scripts like that hundreds of times a year. The second half of the scheme was cleaner and, in some ways, worse. Jafari Hassad billed Medicare and private insurers for procedures she never performed. A patient who came in for a 15-minute conversation about cholesterol would be billed for a comprehensive visit, an EKG, a joint injection, and a lesion excision. A patient who came in for the cash and script cycle would be billed to their insurance as if the visit had involved a full workup. Some patients only learned about the phantom procedures years later, when they requested itemized statements from Medicare and found line items for procedures they had never received. One elderly woman was billed for a colposcopy she had never heard of. Another was billed for the removal of a lesion from her scalp that she was still able to point at, undisturbed, when investigators finally showed her the records. The Medicare fraud alone would eventually be calculated to the dollar at $152,765 in improperly billed procedures. But that was only the piece Medicare could reconstruct with certainty. Investigators believed the true total across private insurers and cash and phantom coding ran to 7 figures. The lifestyle changed accordingly. She traded the leased Mercedes GLE for a leased Mercedes GLS. She and her husband bought a second property in Great Neck Estates for $1.4 million in 2020, financed with an unusually large cash down payment. Niku started at NYU. Arya transferred to a private high school with a $52,000 tuition. Nowruz dinners moved from 30 people to 60. No one asked. No one checked. Not her staff, not her husband, not her billing service, not the state medical board, not iStop. Every prescription she wrote had been logged into the monitoring program exactly as required, because Jafari Hassad was meticulous about the paperwork. The volume was high, but not so high that the state's automatic flagging system triggered a review. She stayed just under the line. She had been running the numbers for years. Stories like this do not get the attention they deserve. Before we get into the sting operation that ended it, if you want to see more accountability coverage on doctors and the opioid crisis, subscribe and hit the notification bell. We cover cases like this every week, and the mainstream press does not. In August 2021, an anonymous complaint arrived at the New York State Department of Health's Bureau of Narcotic Enforcement. The complainant was the sister of a 31-year-old former patient of Jafari Hassad's, who had died of an oxycodone overdose in a rented room in Elmhurst 2 weeks earlier. The sister had gone through her brother's belongings and found 6 months of pill bottles labeled with the same prescriber name. She wrote a 2-page letter. She included copies of the labels. She wrote at the bottom, in blue ballpoint pen, that she did not want money. She wanted somebody to look at this doctor. The complaint was routed to the DEA's Tactical Diversion Squad in New York. A supervisory special agent named Elena Marquez opened a preliminary investigation and pulled Jafari Hassad's iStop history. In the 12 months preceding the complaint, Jafari Hassad had written 2,147 oxycodone prescriptions. The regional average for family practice physicians with comparable panel sizes was 94. Marquez brought in a Nassau County detective with prior narcotics experience and a background as an undercover officer. His name in court records is Detective Sean Halloran, badge number 4271. In court, he described the assignment simply: go in as a new patient, complain of chronic pain, see what she prescribes. Halloran's first visit was on September 8, 2021. He walked into the Great Neck office wearing a plaid button-down, dark jeans, and a knee brace he did not need. He filled out new patient paperwork under a fictitious name and paid the $200 new patient fee in cash. He told Jafari Hassad he had a construction injury from 3 years earlier. He rated his pain a 7. He said he was traveling and could not access his previous doctor's records. The visit lasted 11 minutes. She examined his knee for approximately 40 seconds. She did not order imaging. She did not attempt a physical exam of his lumbar spine, which he had also mentioned. She wrote a prescription for a 15-day supply of oxycodone at the 15 milligram strength. He paid $350 in cash at the front desk and left with the script. The visit was audio recorded and video recorded. So were the next 9. Halloran came back every 2 to 4 weeks for 9 months, sometimes to Great Neck, sometimes to Forest Hills, once to Manhattan. He never provided imaging. He never varied his pain complaints significantly. He described walking without difficulty. He described sleeping through the night. He mentioned in the 3rd visit that his knee actually felt fine and asked if he could still get something for the days it flared up. She wrote him a 30-day supply of Oxycodone 30 milligram tablets. He paid $700 in cash. She never asked to see the knee. The 10th visit was on June 6, 2022. On that visit, Halloran did not come into the office at all. He called the front desk from his car in the parking lot. He said he was running late for another appointment. He asked whether he could pick up the script if he sent payment ahead. The receptionist put him on hold, came back 30 seconds later, and told him to bring cash in an envelope, and she would have it ready. He walked in, dropped the envelope at the counter without a word, and walked out with a signed prescription for a 30-day supply of 30 milligram oxycodone. She had turned her medical judgment into a payment confirmation. She had done it on camera. She had done it 10 times. The DEA and the U.S. Attorney's Office for the Eastern District of New York opened a full investigation in July 2022. They subpoenaed eye-stop data for every prescription Jafari Hassad had written since January 2019. They subpoenaed billing records from Medicare, Medicaid, Aetna, United, Cigna, Blue Cross Blue Shield, Empire, and 8 smaller insurers. They subpoenaed bank records for her personal accounts, her practice accounts, her husband's accounts, and 3 business accounts she held under a small consulting LLC. They subpoenaed lease records for all 3 offices and the Great Neck Estates property. The picture the records painted was clean, cold, and enormous. Between January 2019 and May 2022, Jafari Hassad had written 11,142 oxycodone prescriptions. Of those, investigators identified 3,401 as issued to patients with no legitimate documented indication. Chart notes were missing. Physical exams were not performed. Alternatives were not discussed. Some patients had been dead for weeks or months at the time their prescriptions were refilled. Some patients had never seen her at all. They had been added to her chart system by staff as pass-through names for other people paying cash. The bank records showed the cash. Between January 2019 and May 2022, she had deposited $984,000 in cash across her personal and business accounts in structured amounts, most under the $10,000 reporting threshold. She had made a further $236,000 in cash payments toward the down payment on the Great Neck Estates property. She had paid Niku's NYU tuition in cash by cashier's check 3 times. She had bought her husband a Rolex Datejust for cash at a store on Northern Boulevard. The insurance data showed the phantom procedures. Investigators cross-referenced her billing codes against her chart notes and identified 1 through 207 procedures billed that had no supporting documentation in any patient chart. Medicare's share of that fraud, calculated to the dollar, was $152,765. The 10 undercover buys were the spine of the case. Every visit had been captured on a body-worn recording device and, in most cases, a small, covert camera. Investigators built a timeline synchronizing every recording with the corresponding eye-stop entry, the corresponding chart note, the corresponding cash payment, and, where applicable, the corresponding insurance claim. The gap between what she had documented in the chart and what she had actually done in the room was documented frame by frame. The recording from the 10th visit, in which the prescription was written without Halloran entering the office at all, was the piece prosecutors would later describe as the moment the case ceased to be about medical judgment. investigators also interviewed 23 former patients, 4 former employees, and 2 of her longtime billing contractors. 2 of the employees agreed to cooperate. One provided investigators with text messages sent from Jafari Hassad's personal phone during 2021 and 2022. The exchanges were brief and cold. Roya Jafari Hassad, October 4th, 2021, 6:41 p.m. Tea coming tomorrow, same as last month. Don't book him in a room. Front desk employee, October 4th, 2021, 6:43 p.m. Okay, cash again. Roya Jafari Hassad, October 4th, 2021, 6:43 p.m. Always cash, and update his chart note before I sign. Front desk employee, October 4th, 2021, 6:44 p.m. The one from last month or new. Roya Jafari Hassad, October 4th, 2021, 6:44 p.m. New, same wording, change the date. The wording, when investigators pulled the chart, was identical to the previous month's note, down to the punctuation. The date, in fact, had been changed. The witness tampering count that prosecutors would later add to the indictment stemmed from a separate exchange in which Jafari Hassad allegedly attempted to influence what a former employee would say to a grand jury. The jury would eventually acquit her on that count. On everything else, they would not. Federal agents executed the arrest warrant on the morning of September 14th, 2022, at 6:47 a.m. at the front door of Jafari Hassad's home on 214th Street in Bayside. Simultaneous search warrants were served at all 3 offices and at the Great Neck Estates property. The lead agent was DEA Special Agent Elena Marquez, accompanied by 4 agents from the diversion squad and 2 officers from the Nassau County District Attorney's Office. Jafari Hassad answered the door in a cream silk robe over pajamas. Her husband was in the kitchen. Niku, home from NYU for the weekend, was upstairs. The body cam footage recovered from Marquez's uniform showed the entire interaction. Marquez identified herself and handed over the warrant. Jafari Hassad read the first page silently. Her hand did not shake. Her face did not change. Marquez: Doctor, we have a warrant for your arrest on 8 counts of unlawful distribution of a Schedule II controlled substance and additional counts of healthcare fraud. We are going to need you to step outside with me. Jafari Hassad: I do not understand. There must be a mistake. Marquez: There is no mistake, doctor. We have been in your offices for 2 hours already. We have your prescription pads. We have your bank records. We have the recordings. Jafari Hassad: What recordings? Marquez: You wrote prescriptions to a Nassau County detective 10 times. He was on tape every single time. Once you wrote it without him even coming inside. For the first time in the footage, her expression shifted. It was small. Her mouth pressed into a thin line and her eyes closed for less than a second. When she opened them, she looked past Marquez, over the agent's shoulder, at the black government sedan parked at the curb. Jafari Hassad: I want my attorney. Marquez: That is your right, doctor. You will have full access to counsel. Please turn around. She turned around. Her husband appeared in the entryway, holding a phone. He asked what was happening. She did not answer. Marquez placed her in handcuffs on the front porch. Jafari Hassad did not speak again until she was seated in the back of the vehicle, and when she did, she said only one thing to the agent riding with her. Jafari Hassad: You have no idea what my patients actually go through. Marquez did not respond. The vehicle pulled away from 214th Street at 7:11 a.m. The neighbors would tell reporters later that they had watched the whole thing from their windows and still could not believe what they had seen. Roya Jafari Hassad was indicted by a federal grand jury in the Eastern District of New York on November 8, 2022, on 8 counts of unlawful distribution of oxycodone in violation of 21 U.S.C., paragraph 841, 1 count of witness tampering, and a superseding indictment adding healthcare fraud counts under 18 U.S.C., paragraph 1347. She was released on a $2 million bond secured by the Bayside home and the Great Neck Estates property. Her medical license was suspended pending outcome. The trial began November 12, 2024, before U.S. District Judge Gary R. Brown at the federal courthouse in Central Islip. The government's lead prosecutor was Assistant U.S. Attorney Priya Bhattacharya. Jafari Hassad was represented by veteran defense attorney Marcus Kolodny, who had defended 2 prior EDNY physician cases and won an acquittal in 1. His strategy was straightforward. He argued that the prescriptions were within the outer boundary of medical judgment. He argued that a detective who says he is in pain and describes symptoms consistent with chronic pain is a patient a physician is entitled to treat. He did not argue that the 10th visit had happened any differently than the recording showed. He could not. The trial ran 23 days. The government called 41 witnesses. They called Detective Halloran. They called Special Agent Marquez. They called 2 of Jafari Hassad's former staff. They called the state pharmacist who had reviewed her iStop data. They called 2 medical experts who each testified independently that no reasonable family physician could have written the prescriptions in question in good faith based on the documentation available. They called 4 family members of patients who had died of overdoses after being prescribed by Jafari Hassad. The most difficult testimony came from a woman named Karina Delacroix, whose younger brother had been a patient of Jafari Hassad's for 18 months before dying of an overdose in a Sunnyside apartment at age 28. Delacroix's brother's chart contained 36 entries. 34 of them ended in an Oxycodone prescription. None of them documented a referral to a pain specialist, an addiction counselor, a physical therapist, or a psychiatrist. The chart contained one handwritten note in Jafari Hassad's handwriting that read, "Patient looks tired today. Delacroix, from the witness stand." She saw him 36 times. She wrote him 34 scripts. She said in her own chart that he looked tired. She never once asked why. Jafari Hassad did not testify. The jury deliberated for 3 days. On December 19, 2024, they returned guilty verdicts on all 8 counts of unlawfully prescribing oxycodone. They acquitted her on the single count of witness tampering. The healthcare fraud counts were not before the jury. Those had been severed for a separate proceeding. In April 2025, facing overwhelming documentary evidence on the fraud counts, Jafari Hassad pleaded guilty to healthcare fraud in exchange for a global sentencing consideration. Sentencing was held on March 2, 2026, at 10 a.m. in courtroom 940 in Central Islip. Judge Brown heard 4 victim impact statements. He heard from Delacroix. He heard from the mother of a 23-year-old former patient who had died of an overdose in 2021. He heard from an elderly Medicare beneficiary who described the confusion of finding phantom procedures on her statements. He heard from an internal medicine physician who described the damage that prescribers like Jafari Hassad had done to the credibility of family practice in New York. Kolodny made his final argument for leniency. He described Jafari Hassad's immigrant background. He described her early career. He described her 3 offices and the practice she had built. He asked the court for a sentence of 30 months. Judge Brown addressed her before pronouncing sentence. Judge Brown: Dr. Jafari Hassad, you took an oath. You took it in a language you had learned as a child, in a country that took your family in, at an institution that gave you the training and the license and the trust that come with the title of physician. That trust is not decorative. It is the load-bearing beam of medicine. When patients came to you in pain, real or fabricated, they came to you because they believed a doctor would tell them the truth about what they needed. You told them what they were paying for. That is not medicine. That is commerce with a prescription pad. During the deadliest years of the opioid epidemic in this country's history, you turned yours into a cash register. And the people who paid for those pills, and the families of the ones who did not survive them, will never recover what you took from them. This court has an obligation to speak to the harm you caused, and to every physician in this district who is watching this sentencing, and to say clearly that this is not a mistake. It is not a lapse of judgment. It is a betrayal of the profession. He sentenced her to 7 years in federal prison. He imposed a fine of $150,000, restitution of $152,765 to Medicare, and permanent surrender of her DEA registration and her New York medical license. He recommended designation to FCI Danbury, a low-security federal correctional institution in Connecticut with a satellite camp for women. She reported to FCI Danbury on May 18, 2026. Her expected release date is in 2033. She will be 63 when she walks out. The Great Neck Estates property was surrendered as part of the restitution package. The 3 medical offices are closed. The Bayside Colonial on 214th Street sold in the fall of 2026. Niku finished at NYU. Arya transferred out of his private high school. Reza filed for divorce 11 months into her sentence. Her patients had to find new doctors. The families of the patients who did not survive her practice do not have that option. The case is now cited in EDNY prosecution training materials as a model of prescription monitoring evidence combined with undercover documentation. The DEA has used the 10-visit sting structure as a template for 2 subsequent physician investigations in the same district. Judge Brown's sentencing statement is quoted in a New York State Board for Professional Medical Conduct Advisory issued to every practicing physician in New York in 2026. The oath she took at SUNY Downstate in 1995 hangs in her old office in Great Neck, still framed, still visible through the window, in an empty suite that has not been rented. This case was hard to sit with, but the case on your screen right now takes the betrayal even further. Click it before you leave.